important topic of discussion, hand hygiene. To start with, hand hygiene, I think we all are aware of the steps of hand hygiene, what is the importance of hand hygiene. So in this 20 to 25 minutes of my lecture, I can brief out the important aspects and the important points, what it is important to have the knowledge of hand hygiene. Okay, so overview of this, what is the importance of hand hygiene? What are the indications? कहाँ पे हमें hand hygiene करना है? What are the different agents which are used for hand washing, and what are the steps for hand washing, and what are the steps for monitoring this hand washing? Or we can say that what are the 5 movements of hand hygiene in our day-to-day practices? So as we all know, what is the importance? It is a very important aspect. It plays a very important role now that we have just come out with the pandemic of COVID, where we all have learned that hand hygiene equally was important to get rid of this COVID and get away with this disease. So it is very important. It plays a very important role in hospital infection control. And it is important, so it prevents transmission of infections between the healthcare workers and the patients in the hospital. So to reduce the burden of HAIs, that is the healthcare associated infections, hand hygiene plays a very important role, because if our healthcare workers are having sterile hands, safe practices, sterile practices, so there is less emission of transmission of diseases. The burden of healthcare associated infections is very, very much reduced. It is a very simplest and effective measure for preventing infections. And the burden of HAIs nowadays, when we started looking in HICC, it was very low. Now that with the burdening of the things, we are discussing it almost 20 to 30% times. We are having this hand hygiene practices, very, very crucial. So when do we require for the hand hygiene? First one is during the contamination of the hands. So hands, they're easily contaminated in the ward, in the patient environment area, patient side, bedside. Very easily we contaminate our hands. So either it is direct contact is a common mode of spread, that is the fecal organisms from hand to mouth, that is by dirty hands. Viruses from the hands to the respiratory mucosa and the conjunctiva, leading to viral infections, very, very common, influenza, and rubbing your eyes using bad handkerchiefs with dirty hands. And in many outbreaks, the causative organism is always found on hands. So that is why when COVID pandemic happened, we all were discussing about how important the hand hygiene practices were. So nurses and doctors are other healthcare staff, or the HCWs. They can get more than 1,000 now that we can say we can in millions of bacteria on their hands by doing simple tasks. Are we immune to it, or are we actually contaminating our surface, or are we contaminating our patients, or are we contaminating even when we go home to our family? So while pulling a patient's bed, while taking up the blood pressure, while touching the patient's hand, while touching the patient's surrounding, rolling the patient over the bed, touching the patient's gown or the bed sheets, they are very crucial points in your day-to-day as a healthcare staff you come across, whether it's a nursing staff, whether it's a GDA staff or the ground duty staff, even the doctors, the residents who are working in the healthcare setup. So contamination of hands carrying multiple loads of microorganisms leading to various infections, whether it's a virus, whether it's a bacteria, whether it's a parasite. So this has been one of the plates what we have done 2 to 3 studies in my setup only, where we have seen the contamination in the hands of healthcare workers. And we have done the comparison study also, where we have used the simple basic study, how much the hands of a healthcare staff was contaminated. And to my surprise, to everybody's surprise, I think doctors' hands were much more contaminated than the staff and the other ground duty staff. So when they were supposed to use the hand rubs and they have used the solutions, the hand rub solutions, the contamination rate was very, very much reduced, and it was deteriorated, which eventually showed us that, yes, what is the importance of using this hand rubs and the other procedures. So this is one of the culture plates showing growth of bacteria within 24 hours after the nurse placed her hand on the on this plate. This is a hand technique on a blood culture plate, and multiple organisms can be isolated. So we had the colony of, especially about Coagulus negative Staphylococcus were there, methicillin resistant Staph aureus was there, Klebsiella, and in few of the hands, we actually isolated fungus, aspergillus, and candida also. So giving it a very vast picture of microorganisms only in our contaminated hands. So we can have the measures like with clean hands, what all we can achieve. With dirty hands, definitely we are leading up to healthcare associated infections. So what are the indications when we speak about what are the indications for hand washing? Wash hands with either or non-antimicrobial soap and water, or antimicrobial soap with water when. तो कब आपने पानी के साथ सिर्फ साफ करना है, कब आपने सोप के साथ यूज करना है, which is antimicrobial soap, or it can be non-antimicrobial soap. So eventually, yes, visible, dirty or soil contaminated hands with tenacious material, definitely you have to have with the soap, water and antimicrobial soap. Visibly soiled with blood or other body fluids, of course, again, an antimicrobial soap can be used. And if hands are not visibly soiled, that is in our day-to-day, in a routine rounds, what we see, so alcohol rub can be used to decontaminate the hands. But either it is washing of the hands or hand rubbing with a alcohol-based hand rub, it will be very, very effective to reduce the burden of HAIs. So with decontaminate hands, before having direct contact with the patients, before donning, now that donning and doffing was, am I not audible? Please, somebody, if at all, can write in the text box. Am I not audible? Okay, there was some, madam, I think only slide audible. It is audible to the other people, but I think the others who cannot hear me, please check the technical errors at your side also, please. I think Dr. Lipika and somebody else has also written. Okay, fair enough. We are good to go. Fair enough. Where were we? So decontaminate hands. So before having direct contact with the patients, as I said, yes, it is important. Nowadays, with COVID happening, donning and doffing, yes, every single point after the clean with using of antimicrobial soap, before donning, we were expected to have this hand wash, and then followed by every single step, we were using a hand rub to decontaminate, to have the lesser burden, to have minimal exposure. So before donning sterile gloves, when inserting a central vascular catheter, before inserting any indwelling urinary catheters, which is very common, otherwise we'll be leading our patients to either having clepsy, COTY, or ventilator-associated pneumonias. And after contact with the patient, intact skin, that is nurses, staff, when they take this blood culture samples, very, very important when you're taking the blood samples for the routine laboratory services. I think we need to have a very, very clear instructions to our staff that yes, before doing any taking up the blood, before doing any procedure, please either use a proper hand wash, can be done with a non-antimicrobial soap and water, or else minimum hand rub should be used, or else we are landing the patient to either of the healthcare associated infections. Or after contact with the body fluids or excretion, that is the 5 moments of hand hygiene when we discuss. If moving from a contaminated body side to a clean body side during the patient care, it is very important to use a hand rub. After contact with the inanimate objects, like using just a stethoscope, or you're just touching the bed sheets, or after removing gloves that we learned in donning and doffing, and after wash hands before eating and after using the restrooms. That is a generalized hygienic habit, what we all have been following since our childhood, that yes, before going to the washroom, after going to the washroom, and before and after eating, definitely hand wash is very, very crucial. So what are the hand hygiene techniques? So as we said that wash hands with soap and water, wet hands first. So the basic funda is the 6 steps of WHO has recommended 7 when it comes to the surgical side. But hand washing, when we are using it, 6 steps of hand hygiene are very, very important. If all of us can just go on the videos and perform it along with me. So first one is rubbing from palm to palm. All of us can on the cameras, and we can just have this one point. So when it is rubbing from opening and closing of the tap is not the step for hand hygiene. Please get it very, very clear. Opening and closing of the tap is not the steps for hand hygiene. So the first step includes rubbing from palm to palm. You've already taken water. You've already taken the hand wash with a pump, with a dispenser. Prefer using the dispenser hand soaps rather than having the pocket ones. So forming a proper lather is very, very important, which forms the first part. The forming a lather with water and soap, that is rub palm to palm, is your first step. Moving on to the next step, dorsum of one hand over the other and dorsum of other hand over the first one. So doing it at both the sides. So rub the back of both palms one by one. That forms your second step, right? Moving on, next we have the third step, that is between the interlacing of the fingers, right? Between the interdigital spaces. So after forming a leather, after putting one dorsum of the other to the first one, then for third one is interlacing, rub against the palms, right? Fourth one is interlacing between the fingers, right? The knuckles has to be closed with both the hands. Then the fifth one is the anatomical snuff box area. This part, many a times you just wash it, you just keep it when even doing a hand rub. So this part, the anatomical snuff part, anatomical snuff box area is generally the major area which is left unclean many a times when doing a normal hand rub or a hand wash. So that is why this fifth step was made. This anatomical snuff box area and the thumb area is cleaned properly. Then the sixth one is rub the palms with fingertips, right? So these also has to be the clean areas where we have to focus it on, right? So again, I'll say, first step is all of you, if at all you can do it with your cameras on, it'll be a good picture for all of us. So forming a leather, rub palm to palm, that is your first step. Second step is dorsum of one hand over the other, then on the first one. This is the second step. Third one is interdigital spaces, right? You're cleaning it. Then the fourth one, between the knuckles, right? Fifth one is your anatomical snuff box area. Both the hands you are supposed to follow. And sixth one, rubbing over the palm of the fingertips, right? So all these 6 steps are very, इसको हिंदी में एक पॉइंट दिया गया है, सुमन के पहले आप सीधा उल्टा मुट्ठी, वो फोर्थ स्टेप है लेकिन हम मुट्ठी वाला स्टेप पहले करें, मुट्ठी अंगूठा और के से कलाई, एन से नाखून और के से कलाई, वो जो हम 7 स्टेप करते हैं इन हैंड वॉशिंग स्टेप। सुमन के करके इसको हिंदी में बहुत, अब जैसे हम अपने ग्राउंड स्टाफ को सिखाना चाहते हैं तो वी हैव बीन डूइंग इट मेनी अ टाइम्स, दैट सुमन के करके आप याद कर लीजिए, सीधा उल्टा मुट्ठी अंगूठा नाखून और कलाई, right? So this is what I was talking about when we talk about the maximum areas jahan pe, so red are the areas which are mostly missed out, जो हमारे normal hand wash में हम लोग नहीं देखते होते थे. Then the less frequent missed areas are the blue ones, and not at all missed are the areas जहाँ पे maximum water and soap का content जाता है, and we are able to perform very well. So the main palmar surface, but the dorsum of the other hand is actually left. So these are the typical areas where it is left. So anatomical snuff box, that is why it has been considered. The fingertips has been considered as the 6th step. 5th step has been the anatomical snuff box, and between the interdigital spaces, these were the crucial areas which were generally left in the normal hand wash. When we talk about the surgical hand antisepsis, removing rings, watches, bracelets before beginning of the surgical hand scrub, remove debris from underneath fingernails using a nail cleaner, scrub hands and forearms from the length of the time recommended by the manufacturer. Before, how do you use it before applying the alcohol solutions? Pre-wash hands and forearms मैं कर लेती हूँ. Am I audible now? Am I audible now? Please write somebody. Okay, fair enough. So again, as I said that, okay, I'll repeat. No issues, no issues. We just spoke about the surgical hand hygiene. 1 second. We just spoke about, just rotate it. We spoke about the surgical hand antisepsis. So जब भी आप surgical hand rub कर रहे हैं, so remove rings, bracelets, everything has to be removed. First of all, surgery में you're not supposed to wear all these ornaments. Then remove debris from the underneath fingernails. First of all, nail should be properly cut and no increase of nail. It is never ever recommended. And scrub hands and forearms for the length of the time recommended by the manufacturer, usually 6 minutes. And alcohol rub, pre-wash hands and forearms with non-antimicrobial soap and completely. And whenever we are doing the 5 movements of hand hygiene, we need to perform the hand rub. So I was talking about what are the 5 movements of hand hygiene. I spoke about the hand washing 6 steps. That is Suman के भी आपको हिंदी में मैंने बता दिया. Because at times when we are teaching the staff or the lower staff, we need to have a brief idea कि इनको कैसे पढ़ाना. And when we talk about 5 movements of hand hygiene, the first and the foremost is before touching the patient, before doing any aseptic procedure. Third one is after any body fluid exposure. Fourth one is after touching the patient, and fifth one is after touching the environment of the patient. इसमें भी एक logic याद कर लीजिए, 2 befores and 3 afters. So first 2s are before touching the patient and before doing any aseptic procedure, and the remaining 3 afters are after any body fluid exposure, after touching the patient, and after touching the environment of the patient. Sometimes हम लोग पूछते हैं अपने बच्चों को कि मतलब whenever I go for a round for clinical rounds, then what are the 5 moments of hand hygiene before touching the patient, after touching the patient? No, the series cannot be broken up. No, आप अगर morning rounds करवा रहे हैं आपका health care staff, you need to follow certain protocol. आपने patient को touch किया, hand rub किया, आपने patient का blood pressure लिया, hand rub किया. By chance, by any this thing, some nurse has just chased the Euro bag and just fiddled with the Euro bag. You are supposed to have the clean practices. So hand rub is required. Then after touching the patient, again you are supposed to hand rub. Then after touching the environment of the patient, the whole hand rub procedure for 5 moments of hand hygiene is complete, right? So what are the selection of hand hygiene agents? Must be of low irritancy potential. Obviously, it's a contact dermatitis kar dega. Type 1 hypersensitivity reaction for you. Type 4 hypersensitivity reaction. Then input from healthcare worker regarding what is the feel. Is it not irritating? Skin irritant only hai. Your skin is able to tolerate. Get feedback from your staff also. Not that one particular product is okay with you, but it cannot be okay with the other rest of the team. We should have the feedback from our staff also. The cost should not be primary factor influencing product selection. Ye cheap hai, ye best hoga. No. That cannot be taken up. Whether it has got 70% ethyl alcohol, chlorhexidine is there or not. These basic steps we need to, these basic things we need to have in an alcohol rub. Solicit information from manufacturers regarding any known interaction between products used to clean hands, skincare products, and the type of gloves used in the institution. So इन तीनों चीजों का ध्यान रखना है. At times हमारे पास staff आता है कि मैम मुझे fungal infection हो रहा है because using this hand rub. Sometimes it is not because of the hand rub. It is because in the wet hands only you're using the gloves. Sometimes there are people with contact dermatitis, they can have problems with the gloves, but not with the hand rub. But you have to rule out such problems also. As a HICC head, ensure the dispensers function adequately and deliver an appropriate volume of product. So, आपका hand rub है with a very small nozzle, it is not able to put even a drop over your hand. Or for hand soap, if at all you say that कि अगर antimicrobial soap आता ही बहुत कम, एक drop से भी बहुत कम आ रहा है, so you need to check all these technical errors. Do not add soap to a partially empty soap dispenser or as a topping of, or can lead to bacterial contamination. Many a times these practices are followed. कि कम soap डाल के उसमें आप पानी mix कर दें, उसको dilute कर दें. No, such practices should be stopped. Half dispenser में उसको topping up करके डाल दें. No. That practices should not at all be followed. Provide healthcare workers with hand lotions or creams to minimize the irritant contact dermatitis. If at all there is some healthcare staff who is having troubles with that, make sure you are providing them with some emollient or some creams, hand lotions. What are the other aspects of hand hygiene? Do not wear artificial fingernails or extenders. Of course, as I said that as a healthcare staff, you're not supposed to wear ornaments, rings, bracelets, and your fingernails should be properly cut and trimmed. Keep natural nails tipped less than 1/4 of the inch long. Wear gloves when contact with blood or other potentially active body fluid is required. Otherwise, hand rub is quite effective. Remove gloves after carrying the patient. Not that the same glove has to be carried out with. उसी से आप notes डाल रहे हैं, उसी से आपके काम के. Many a times the overworked interns, overworked residents, they blame that हम gloves में ही हमने तो मतलब सारे notes भी डाल दिए. That practice should be stopped. And do not wear the same pair of gloves for the care of the more than one patient. This is what I was coming to कि एक ही patient की dressing एक ही gloves के साथ आप करे जाएं, दूसरे पे भी आप same gloves के साथ चले जाएं. That practice has to be stopped. One pair of gloves is actually meant for one patient, not that the second pair आपने hand rub कर लिया and you can use the same gloves with the for any other surgical purpose also. So for one patient, one pair of gloves. Or else when you're moving, as I said, 5 movements of hand hygiene are very, very important when we're moving on to the next patient. Otherwise, one Klebsiella or one Pseudomonas will be transferred from one patient to another patient, which should be stopped. That is how the burden of HAI is increased. No? Do not wash gloves between uses with different patients. Again, this practice earlier used to happen, but nowadays I don't think so any of the healthcare setup is using one pair and different patients. One pair of gloves and different patients. Change gloves during patient care if moving from contaminated body side to clean body side. Yes, of course. अगर आप किसी patient के bed sores या किसी deprived wound अगर आप देख रहे हैं, आपने वो pair of glove लगाया है, उसी से अगर आप patient का blood pressure ले रहे हैं, stop these practices. These practices should be obsolete. मतलब इसको नहीं करना चाहिए. What are the administrative measures when we talk? Make improved hand hygiene adherence and proper policy. Hand hygiene health policy बहुत important है आज की डेट में. Implement multidisciplinary program to improve hand hygiene or adherence to health personnel to recommend hand hygiene practices. Every day, your ICN, infection control nurses, will play a very pivotal role in enhancing or developing this hand hygiene practices. Every day, if at all they are going for rounds, it will be very good for our healthcare system. Provide healthcare workers with readily accessible alcohol-based hand rub. As I said that अल्कोहल हैंड रब भी उसमें पानी नहीं डालना है, जो हैंड वॉश आते हैं उसमें भी पानी डाल के नहीं रखना है. Adequate supply of hand wash and hand rubs should be given to the healthcare staff. In areas where high workload with high intensity of patient care are anticipated, alcohol-based hand rubs are available at the entrance. Patient के entrance room पे होना चाहिए, bedside होना चाहिए, in other convenient location, nursing station पे होना चाहिए. And if possible, can be carried now that after COVID era, many people are carrying in their pockets also. Store supplies of alcohol-based hand rubs in cabinets or areas approved for the inflammable. This is very important for our laboratory purpose. Yes, आप नहीं कह सकते कि आपके पास hand rub नहीं है. People who are performing in our biosafety cabinets also, they need to take care of hand rubs. So barriers to hand washing. A lack of access to hand washing sinks. कई बार क्या कहते हैं, क्यों नहीं किया? मैम सिंक नहीं है इसलिए नहीं किया, टाइम नहीं था हमारे पास. मेरे को स्किन इरिटेशन है, कंटेक्ट डर्मेटाइटिस है, डॉक्टर ने बोला है कम से कम हाथ साफ करो. एंड द बेस्ट पार्ट, मैम हमें पता ही नहीं था हाथ साफ करने हैं. और इंडिविजुअल प्रेफरेंसेस और हैबिट्स, like just as but all I say, before eating, how many of you before eating and after eating your food, after having your meals, you're washing your hands, after going to the washroom or the restroom, you're using the hand wash? These are the basic things everybody needs to know. Making excuses कि मुझे पता ही नहीं था, सिंक बहुत दूर है, टाइम नहीं था. These all excuses should be stopped, because if at all we want to reduce the burden of this corticlepsy around us, we need to have the change in the attitude also. The basic funda is change in the attitude, and then I think we can achieve our targets, our goals. Make hand washing facilities as much as possible, as much as available to the doorstep of the people who are working. Periodically monitor and record adherence. So एक पॉइंट इसमें बोलूंगी, हैंड हाइजीन ऑडिट होना बहुत ज्यादा जरूरी है. हैंड हाइजीन सर्वेलेंस होना बहुत ज्यादा जरूरी है. वो आप कैसे करेंगे? आप एक जगह पे लेट्स से किसी आईसीयू में अगर आप अपना आईसीएन स्टाफ या आप एज अ डॉक्टर यू आर जस्ट count the number of movements, what the hand hygiene movements they were followed. When a person is doing a hand wash, did he or she follow the steps of hand washing? So based on that, 5 movements and the 6 steps of hand washing, generally on points of 11, we give the marks to our staff. This is the surveillance parameter for my district, for my hospital. Everybody can add up things if at all you want, but these are the prime 6 steps and the 5 movements of hand hygiene, which everybody is looking in the surveillance part. So when outbreaks of infection occur, assess the adequacy of healthcare worker hand hygiene. आपने कितने लोगों को पढ़ाया है, कितने लोगों को सिखाया है, कितने लोगों को सही से टेक्निक करना आता है, कितने लोगों को 6 स्टेप्स पता है, कितने लोगों को 5 moments of hand hygiene पता है. All this data, it's not just a paperwork. I think everybody needs to be accountable. Yes, if this is happening in a particular area, definitely you need to understand that what was important. Why is the infection rate low at a particular ward or a ICU is less than the other one where you are having an outbreak of some kind of microorganism. So maybe the practices, maybe the healthcare staff was very much aware, maybe they were much more resourced, they were using proper hand wash and hand rubs. So all these resources, all this knowledge, all this surveillance, daily surveillance are very, very important to have a good hand hygiene practices amongst your healthcare staff. What do you need to wash hands effectively? Sink with wrist, elbow, clean paper towels होने चाहिए. Don't clean your area with the same जिसके साथ जिस hand के साथ अपने आपका sink on किया उसी के साथ आप उसको close करेंगे. Either you use a napkin or you close it with your elbow. And liquid soap should be available rather than the pocket ones, the soap boxes. So stop when wash your hands before starting any work, while using a washroom or restroom, after any work break, when your hands are soiled by work, or before putting up any gloves, that especially in donning and doffing areas, please, please, please prefer to use hand wash or a hand rub because it is ideal. It is very, very crucial. That is all I have to speak. One word about the hand wash and the hand rub. So what is the contact period for hand wash? It is generally said that 1 minute ke liye haath dhona is important. It is very, very essential. At the same point of time, what is the contact period? It is 40 seconds is the contact period between using and forming a lather and doing the 6 steps. This is the contact time when you're actually trying to reduce the microorganism burden from your hands. And what is the contact period for hand rub? Only 30 seconds is required to do a hand rub. But what is the contact period? It is 15 to 20 seconds for the contact period for a hand rub. So this was all about hand hygiene, hand hygiene. So 6 steps of hand washing and the 5 moments of hand hygiene are very, very crucial and very, very important for hand hygiene practices to reduce the burden of healthcare associated infections in your own setup. And please ensure your healthcare staff is well knowledged and well surveillance is done on a very regular basis to come across with less number of microorganisms in the hands, or else we'll have blood culture plates having all that Pons, Staph aureus, E. coli, and all other microorganisms. The kitty party of microorganisms will be seen. Yes, Madam, Dr. Lipika, the slides will be shared with you. Mr. Rohit will do the needful for you. Any questions on hand hygiene? I think the basic idea